Welcome to the EAUN podcast edition of EAU Podcasts. In this EAUN podcast episode, we are delighted to be joined by Therese Kelly, an advanced nurse practitioner in urology at Galway University Hospital, Ireland, and Eva Wallace, a retired neurourology nurse from National Rehabilitation Hospital in Dublin, Ireland. Together, they will provide valuable insights on addressing continence issues, discussing a holistic approach, offering practical guidance for healthcare professionals and patients alike. Join us as we embark on this informative journey.
Thank you all for joining us on this EAUN podcast, Continence Matters, How to Navigate Life's Leaks. My name is Eva Wallace. Continence has always been a passion of mine, and I'm delighted to be here today with a colleague who will now introduce herself as we chat away together.
Hi everyone, my name is Therese Kelly and my job sees me assessing patients with lower urinary tract symptoms, including urinary incontinence. Everyone has their own individual continence story and it's like a jigsaw. And as healthcare professionals, it's our job to assist you to complete this jigsaw to promote continence and improve quality of life. The debilitating and chronic consequences of urinary incontinence can be felt across the gender divide, age and socioeconomic backgrounds, and can result in serious and negative impacts on individuals' quality of life.
Therese, as you know, there are several types of incontinence, each with its own cause and symptoms. Therefore, it's essential to have a holistic continence assessment, and there are numerous questionnaires that often need to be completed. They can be used to evaluate symptoms and patient-reported outcomes. Good continence care is really not about managing incontinence, but it's about the skills of fine-tuned healthcare professionals seeking to listen and identify individuals' needs, values and goals. Conservative management is a key component of this. Continence issues are more than a minor inconvenience. They have a huge impact on the quality of life and can lead to social isolation, depression, sleep disturbance.
Did you ever consider the financial impact, Eva, as well for patients?
Of course.
Simple things, simple measures like toilet location, the lighting in the house, household adaptations that have to be done. So the treatments for urinary incontinence will depend greatly on the types and the severity of the condition. So let's talk about some simple measures, Eva, that patients could trial, like fluid and food management. What we eat and what we could drink has a huge impact on our bodies and particularly our bladder. Caffeine products such as tea, coffee, green tea taste lovely. However, they are diuretic and increase urinary production, can irritate the bladder by stimulating the bladder muscle, causing the bladder to contract more and exacerbate symptoms of overactive bladder and urinary incontinence. Eva, recently I had a lady in the clinic and she drinks green tea as recommended by a friend. She didn't see that it was irritating the bladder, but when she stopped it for a week, her symptoms nearly just about totally resolved, which was amazing. So caffeine can be hidden in many drinks, such as high energy drinks, some sodas and some chocolate products.
I agree, Therese. Just reducing caffeine can make a big difference. But don't forget, artificial sugars and sweeteners also need to be avoided. We also need to consider the fluid that we drink and what type of fluid you've discussed, but we also need to know the volume. And 1.5 to 2 litres a day is the average recommendation for daily intake. While monitoring this, a bladder diary is really excellent resource and it monitors everything perfectly. The bladder diary, it's another piece of a jigsaw, and it would identify voiding patterns. It can monitor the fluids. It can help you to assess the severity of the symptoms, how frequently they're going. It helps you to track the progress. It's an easy way to facilitate communication over an embarrassing subject, and it can give you concrete data that can be used for meaningful discussion.
It also empowers the individual, Eva, to take an active role in their health and to be part of that decision-making process. It's got to do with the treatment options that they have.
I agree.
And I think a very touchy topic or subject, Eva, is weight. Weight management is a key component to continence, and how we manage that is vital because it can be a very sore subject for patients because it can be difficult to manage your weight. And obesity is associated with weakening of the pelvic floor, which is crucial for bladder control. And by maintaining a healthy weight, individuals may experience a reduction in urinary frequency and urgency and leakage of urine, leading to a better bladder. And obesity is also associated with other comorbidities such as diabetes and cardiac failure, which can actually have a problem with exacerbating of urinary incontinence.
Yeah, I agree, Therese, and weight management will complement other treatment approaches such as pelvic floor management treatment and would optimise bladder health. Pelvic floor muscle dysfunction can also affect bowel as well as the bladder, and weakness or tightness in these muscles can lead to urinary or fecal incontinence or indeed difficulty emptying the bladder or the bowels. Pelvic floor muscle treatment is designed to strengthen and relax the muscles, which can assist in the management of urinary incontinence, supports pelvic organ prolapse and improves sexual function. Overall, I would think consistency is the key to seeing improvement. It's essential to make the pelvic floor exercise a regular part of your routine, just like you do with brushing your teeth or going to the gym. Whatever it is, you must have it as a routine. In order to learn pelvic floor exercises correctly, I think it's really important that you attend a pelvic floor physiotherapist or a healthcare professional for professional guidance on how to do these exercises correctly.
And as you mentioned routine there, Eva, I was just thinking about the bowel, how it can indirectly affect the bladder in several ways. Like constipation can put pressure on the bladder, increase frequency and could cause urinary retention. And while straining can have put pressure on the pelvic floor and lead to a prolapse or increased frequency and urgency. So it's vital to establish a regular bowel routine to achieve the correct bowel consistency. Healthcare professionals could use the Bristol stool chart for guidance.
It's all about training really and expertise. It's very difficult, but it's so important when it comes to the likes of continence wear, maintaining skin integrity. It's really the key for continence advisors that they can give the correct advice. The ICS gives us guidance on continence wear, from disposable products to single or reusable. So many on the market, too many to discuss here today. But there are eco-friendly pads which are made from a plant-based material, and they're designed to control urine odour, protect the skin with various designs available. So there's lots of new things coming out on the market.
And I suppose that is the key thing, Eva, is everyone to be aware that there is new products coming available, and some of them are very eco-friendly, which is brilliant to see. And I suppose medications is another key part of the jigsaw, which can be difficult to piece together due to side effects. And there are several medications that can be used to treat urinary incontinence, such as anticholinergic medication for the treatment of detrusor overactivity. However, this medication should be used with caution with elderly patients, as it can cause confusion, but also it can cause dry mouth and constipation, which can cause patients to stop taking the medication. You have beta-3 agonists, which relax bladder muscles and increase capacity and reduce frequency and urgency. And topical estrogens can benefit ladies in the postmenopausal era to strengthen the tissue elasticity of the urinary tract. Alpha blockers are very beneficial for gentlemen with enlarged prostates, increasing urinary flow, while desmopressin can be used for nocturnal anuresis by reducing urine production during the sleep. Routine follow-up is essential for patients when they start medication, and in particular desmopressin, where you should monitor sodium levels.
I agree with all that, really. It's quite difficult to get everything right, but urinary incontinence is really one of the most bothersome diseases amongst chronic disorders. And there are 55 to 60 million Europeans affected. Urinary incontinence is really a neglected and embarrassing condition.
I totally agree with you, Eva. Let's get chatting. So please talk to your healthcare professional who will guide you on the continence path. Without better awareness, education, prevention, treatment and resources, this burden will increase in healthcare systems throughout the world.
Have you heard about the Urge to Act manifesto for policy reform? This is a collaboration supported by EAUN, where it states the financial burden of incontinence is estimated at 40 billion for 2023 and will increase to 320 billion by 2030 if no action is taken. Breaking the taboo around continence is like completing a jigsaw puzzle. It requires assembling various pieces to create a clear picture and understanding. We hope this has been of some benefit. Thank you for listening.
Thank you for listening.
Thank you for this insightful episode. We are sure our listeners enjoyed it. To keep up with the latest EAU podcasts and stay informed on urological advancements, be sure to subscribe to our EAU podcast channel on your favorite podcast app. Until next time, keep learning and stay inspired.